Hello, welcome on my channel. Today I want to talk about insulin resistance and why insulin resistance should be as well known as diabetes is, and why people should be as scared as they are of diabetes, and how this has all to do with our current food and our current food guidelines. So if you're sick and if you have diabetes or any other chronic condition, stay tuned and I explain why and how we can all of this reverse. So insulin resistance and how this is the root of all evil. So again, this is no medical individual advice. If you're metabolically unhealthy, please see a low carb clinician. Especially in this regard, you should be very choosy with your doctor. Please choose a low carb clinician to help you reverse completely or to a great deal your chronic conditions. So I would like to show you how type 2 diabetes has developed over the last 60 years. And here's some data from the CDC from America, and how the prevalence of diabetes has increased sharply, especially since the 80s, 90s. So what has happened? Something magic. So in 1977, the FDA publishes the dietary guidelines for Americans. And a few decades afterwards, diabetes has started sky rising high. And that's sort of evidence worldwide. So that's not only data. So these are the data from America, but I think if you look around the world, you can probably copy and paste the same similar sort of shaped curve everywhere. So what happened? So the food pyramid, that's what we know today. So we are supposed to eat not much fat, lots of carbohydrates, plenty of fruits and vegetables, moderate amount of meat and dairy products, and hardly anything sweet or fat. So we basically end up having a dietary guideline that is high in carbohydrates and low in fat, which at the same time is the perfect breeding ground for diabetes and obesity and all the complications and comorbidities that come with it. So just upfront, there has never been any solid scientific evidence for that current food pyramid. But unfortunately, at the same time, the power of money spoke a little bit louder than reason. So hence we have the guidelines we have today, even though it's been disproven many, many times. But money is always a bit more powerful than anything else. So I have another video about the whole history of how we actually got here and how the food guideline came into existence. But that would sort of totally explode this sort of scope of this video. So why do the guidelines cause so much trouble? Most people know that sweet things are probably not good, but most people don't know if they just have one bowl of rice, they consume as much as 10 teaspoons of sugar. If they have just a normal serve of potatoes, they consume as much as 9 teaspoons of sugar. If they have just one serve of pasta, normal pasta, it doesn't matter if it's processed pasta, wholemeal pasta, you in general consume as much as 6.5 teaspoons of sugar. If you have breakfast cereals, they have between 5 and 7 teaspoons worth of sugar in them. Some are worse, some are maybe slightly better. And bread, usually per 2 slices, just 2 slices of any bread, you consume between 4 and 6 teaspoons of sugar. And it doesn't really matter if it's a wholemeal bread slice or if it's a white bread slice. So it doesn't really matter. So I hope this sort of clarifies that with the carbohydrates, which are all those ingredients here on the left, you're basically consuming sugar. And no one would argue about that sugar is this is a bad thing. So everyone wants to reduce sugar, but no one ever talks about reducing carbohydrates, which is a form of sugar. So that's why consuming all those so-called healthy foods at the bottom, or plenty, which is at the bottom of our food pyramid, is probably not such a good thing. So here we are with our food pyramid. So what happens? So the sugar or the glucose enters our body, enters the bloodstream. And once it's in the bloodstream, it's kind of a poison because sugar is usually sticky and it sticks to everything. So it forms so-called advanced glycated end products, which is highly toxic as long as it's in the blood. So it contributes to atherosclerosis, which is the clotting of your arteries, Alzheimer's, it damages your eyes, it damages or it leads to a loss of elasticity in your cell walls, to arthritis, to renal failure, all of this. But we're not that stupidly designed. So we have an organ called the pancreas, which sits right left under your left sort of rib cage. And the pancreas makes insulin. So insulin is there to save the day. And what does insulin do? Insulin has many, many functions, but it also enables the sugar entering the cells. So how this looks like is like, okay, this is the cell. Here comes the sugar with our food. And then insulin acts basically like a key to a lock. And it unlocks that lock, so it unlocks the door so the sugar can enter the cells. So that's what insulin is for. And what does insulin do on all those different organs? And here I just want to basically concentrate on what happens in the liver, what happens in the muscles, and what happens in the fat cells. So when insulin is there, it enables the sugar going into the cells, and then the liver converts the glucose into glycogen, which is the normal storage form of sugar. It also enables protein synthesis. And what it also does, whenever there's excess glucose in the blood, it converts all that sugar into fat. It's called de novo lipogenesis, which means translated fat making. As long as insulin is present, the fat and the sugar or the glycogen cannot leave the liver. So the liver keeps it all in check. So the muscles can store a little bit of glycogen, quite a fair bit, and they burn a small amount of the sugar. And they're quite sort of a good storage form for glycogen, which is usually about 1,500 calories. At the same time, as long as insulin is present, the muscles cannot let go of it. And then we have the fat cell. So the fat cell can take on fat, and it can also take the sugar on board. And what the fat cell is doing, it converts all the glucose straight into fat. So fat is the safe storage form in the fat cell from sugar. So the fat cells do to a great deal de novo lipogenesis, which is again the fat making process. And as long as insulin is present in the bloodstream, the fat cells are unable to let go of those contents, which is the sugar. So I have another video explaining in detail how carbohydrates and insulin make us fat. So check that one out. So the bottom line is when we eat, insulin goes up, and the liver and the fat cells store fat and glucose, and the de novo lipogenesis is turned on. If you're not eating, or if we eat food which is very low in carbohydrates, insulin goes down. So, and the liver burns the stored fat and the glucose, and it releases everything that is stored. So if there's a good balance between eating and fasting, everything is fine. So even with the current food pyramid, it's fine. The problem is we are supposed to have 3 meals a day with snacks in between. So meaning we have constantly a diet rich in carbohydrates. So, and that's what happens. So if we eat too much carbohydrates, or if we eat according to the guidelines, we have the problem. So our cells are basically saturated with glucose, but we're eating more and more and more. There's more glucose coming in, even though the cells are saying, no, I'm full. So then the pancreas is making more insulin, basically knocking harder on the door to finally unlock those remaining receptors to take the glucose on board. And our cells become bigger and bigger and more damaged, because the glucose needs to go out of the blood. Otherwise, it's not a good thing. So if your blood sugar level is too high for too long, you're going to die in a day or two. So that's why we need the insulin to lock or to put the sugar into the cells. So on a less biochemical level, it looks a little bit like this. So that's everyday situation in Japan. So we have more and more people lining up, which represents the glucose, and more they're called the people pusher. And there's actually good, well-paid jobs to push people into the trains, which are full, but they push harder and harder and harder. So insulin goes up. So they employ more and more and more people to push the people into the trains. And that's the same thing what happens in the fat cells. So we get more and more insulin and we push more and more sugar in, making the fat cell grow, and we push more and more sugar in, and the liver converts more and more sugar into fat. That's how we end up having a fatty liver. But I designate another video for just the fatty liver disease. So how does it look over time? So here's a graph representing insulin and the HbA1c, which is, every diabetic knows that kind of blood test, which is the long-term sugar level, which doctors use to diagnose diabetes. So over time, the pancreas is pumping out more and more and more insulin to cope with the ever-growing demand of sugar, sugar that needs to go into the cells, just to keep the blood sugar level normal. But the pancreas needs to pump harder and harder and harder, making more and more insulin. So that's the process, or that's the state which we call insulin resistance. We are insulin resistant because the cells are not able to take more. So they are becoming resistant. They cannot allow to have more sugar on board. And hence the pancreas is trying to compensate, pumping out more and more insulin. So normally in conventional medicine, we only ever, we as clinicians, you only ever measure the HbA1c. Hardly anyone is measuring insulin levels. So I don't understand why this is not a routine check. We take PSA levels to check for prostate cancer at a certain age. I feel like everyone should be routinely screened for insulin levels. If your insulin level is elevated, meaning that means you're insulin resistant, the disease process has started already. So normally doctors take only HbA1c levels and they say, oh yeah, I checked all your bloods and you're fine. Whereas in reality, if that doctor would take an insulin level, the patient is not fine. Absolutely not. The patient is insulin resistant. So over time, if we take more and more in, something happens with our bodies, and we switch over and become diabetic, and our whole sort of system falls down like a cardboard house. So what actually happens? So glucose is ever present. The fat cells are growing bigger and bigger, and as in the process of growing, the fat cells are basically sending out inflammatory markers. They're crying out for help. So that's why if someone is a little bit overweight with increased size of the fat cells, obesity or overweight is an inflammatory condition, because that's what the fat cells are saying. They're full, we can't grow anymore, please send us help. And that's a constant inflammatory marker. So if you are overweight, you probably have got mildly raised inflammatory markers. So as the fat cells cannot take more on board, they start spilling over. The fats are starting spilling over into the visceral fat, which is the fat that lines is around our organs. And that's basically the dangerous fat. It spills into the liver, into the muscles, into the pancreas. It spills all over the body. It's just a complete sort of fat war zone. So insulin resistance, or it is believed that insulin resistance starts because your adipose cells are full. The adipose cells are your fat cells. So then, and as the fat cells can't take more in, the blood sugar rises a little bit because they're just unable to cope with any more. Then the same level happens at the muscle level. Muscles are saying, no, we can't, we just cannot take more on board, we're full. And the muscles cannot grow any bigger. So when they're full, they're full. And the same happens with the liver. Liver becomes increasingly insulin resistant, meaning the liver can't take more fat, can't take more glycogen on board. Same as the muscles, they can't take more on board. So as all the storage is completely full and there's nowhere to go for the sugar, and the organs becoming increasingly resistant, the pancreas eventually tires out. There's no storage for the glucose anymore. The blood sugar level will consequently rise more and more. And as the pancreas becomes more insulin resistant in itself, it cannot keep up with the demand anymore. So, and the liver, the sad part is the liver will continuously making fat, but it's also not able to keep the sugar stored, it just keeps leaking out, and which contributes to higher elevated sort of blood sugar level. So our whole metabolism basically falls apart with rising blood glucose levels. So how does it look on our curve? So up until now, we've been insulin resistant, and our organs have been fighting already, and then the pancreas fails, and the pancreas is not able to make more insulin to keep up with the sugar levels. So the sugar levels will start rising. So this is the point when patients normally get diagnosed with diabetes. So at the time of diagnosis, everyone agrees that damage is done. And as you may have noticed in the previous slides, the body is at an internal war zone already. So no one argues against that. Once you're diagnosed with diabetes, damage is usually done. So that's actually a well-known fact. So in conventional medicine, what we do now, we give you medications that tackle the sugar level. So we give you medications that make the cells more sensitive again, which means that we force your body cells to take on more sugar. We give you medications that you pee out the sugar. We give you medications that you don't absorb the sugar in your guts. We give you medications that the pancreas is spitting out more insulin. Remember, the pancreas is exhausted, and now we force it with medications to actually take more on board. So in conventional medicine, we believed, or the majority still believes, it's a starvation problem. The cells are starving, and there's something wrong with the lock and key mechanism, that the lock of the cells is broken, hence the insulin cannot get the sugar into the cells. Whereas in fact, the truth is it's an overflow problem. The cells are full. So, and medications are actually making it worse. We try to push more and more in and more in instead of treating the insulin levels. So to come back to the analogy, it's pretty much looking like something like that. So you're pushing more and more in, we employ more and more people pushing more sugar in, and to get the sugar in, and it's not healthy. That's just a classic situation. So pushing, it really doesn't look healthy to me at all. And that's exactly what we're doing with medications to try to tackle diabetes. Yeah, it doesn't look healthy at all. And it's actually backed up with science as well. So here's the Accord study that actually had a look at HbA1c levels and mortality, and it's been found if we lower the HbA1c, the sugar level in the blood with conventional treatment, the mortality actually goes up. Shoving more sugar in means you have an increased risk of death by about 22%. And additionally, most people put on more than 10 kilograms of weight. So I've linked all the studies below. You can read the studies yourself. The advanced study, this one here, actually showed as well there's no significant effect on the major macrovascular events or all-cause mortality with intensive treatment of blood sugar. So, and they also found that people have much more hypoglycemia events than in the control group, in the not so intensive control group. Hypoglycemia means blood sugar coming down too low. They have sort of events where the medication is pushed too low, and then the people get sick on the other end. And here's a really nice study done by Turnbull. It's a large meta-analysis where they had over 27,000 participants, and they've been closely monitored. And they actually found that there's no clear benefit that people have less chance of dying of cardiovascular diseases or non-cardiovascular deaths by controlling blood sugar levels too much. So the bottom line is taking medications to intensively lower the blood sugar level, it doesn't really make you healthier. The problem is no one is addressing the insulin problem. So everyone is addressing the sugar problem with medications, but not the insulin problem. So, and if you think that diabetes is only one thing you can get with too much insulin, there's a whole lot of other things that are lined up, which you get once you have too much insulin in your blood. It means you're insulin resistant. So you have a much higher chance of developing Alzheimer's, neuropathy, which is nerve damage, retinopathy, which is the damage of your eyes. So many diabetic people become blind. You have a higher chance of getting Parkinson's disease, all sorts of neuropsychiatric disorders, and autism. You have got the non-fatty liver, non-alcohol fatty liver disease. So you can get fatty liver just by consuming too many carbohydrates, as they're all converted into fat. Without drinking any drop of alcohol. So normally it's the alcoholics that used to get the fatty liver, but you're well lined up if you're having too much sugar in your blood. Ulcerative colitis, so that's an inflammatory condition of your bowels. Of course, the type 2 diabetes mellitus, so the type 2 diabetes, gestational diabetes, which is diabetes while you're pregnant. Most people have chronic inflammation, which has its own whole set of complications. Polycystic ovarian syndrome, and of course breast cancer. So because cancer cells they're really, really high with insulin receptors. They just love to gobble up the glucose. So that's why having too much insulin in your blood, cancers like breast cancer, ovarian cancer, especially colon cancer, pancreas cancer, and prostate cancer, or liver cancer, they're all highly and closely linked to hyperinsulinemia or insulin resistance, because cancer cells just thrive of sugar, and they just thrive, with lots of insulin receptors. Atherosclerosis is the clogging of your arteries, the cardiomyopathy, which is a misshaped heart, so the heart can't pump efficiently anymore. Endothelial dysfunction, so it's like all your little blood vessel cells are becoming completely dysfunctional, which is your peripheral vascular diseases. So all your small peripheral blood vessels are, tilting over, which gives you the stroke, which gives you the clotting, the DVTs, and also the hypertension, the high blood pressure. Nephropathy means your kidneys are significantly damaged. And erectile dysfunction. And some experts actually argue, they say, okay, erectile dysfunction is probably one of the early signs of insulin resistance. Osteoporosis, so your bones are getting weaker. And of course, it's not good for your teeth either. So insulin resistance is something bad, and people should be aware of it. And that's why I said in the beginning, everyone should know the word insulin resistance and should be as scared of as they know diabetes is a bad thing. So it's really the breeding ground for so many chronic diseases, which can be easily fixed by just addressing the insulin level. In conventional medicine, of course, we have medications for most of these conditions, but we are not really addressing the root cause, which is the insulin resistance or the hyperinsulinemia, which means hyper is too much insulin, and emia means in your blood. So it means too much insulin in your blood. So if you have too much insulin in your blood, it means you are resistant, because otherwise the insulin levels wouldn't be so high. So all of that sounds really, really scary, I know, and it is. Insulin resistant is nothing to play around with, but the solutions are actually very, very simple. Just adopt to a low carbohydrate diet. Just cut out your carbohydrates to a minimum, replace it with some more fat, and you should be good. I have an entire video dedicated explaining the details of a low carbohydrate, high fat diet. If you don't have the time to listen to it for almost an hour, I have a quick guide as well to get you started. And the second easy trick is just do intermittent fasting. Don't eat all the time. You don't need three meals a day and snacks in between. You don't need that. We didn't do that for many millennia, and we don't need to do it now. So in order to reduce your insulin levels, just cut down on the food. And I have another complete fasting video for that. And in the video, how to do a low carb, high fat lifestyle, I talk a little bit about fasting as well. But they are the two solutions basically to get rid of insulin resistance. So after all this drama, you probably wonder, oh my God, am I insulin resistant? Of course, the easiest way is to go to your doctor and ask if you can have an insulin level done. So here in Australia, it doesn't cost anything. So it can be just added to any routine bloods. And if that level is above 6, you have mild insulin resistance. If it's above 10 or 15, you have you're on your best way to become really sort of solidly insulin resistant. And if your doctor is asking why, then just say, well, I would like to find out if I'm sick before you diagnose me with sickness. So, but you can do some self-checks. So if you have skin tags, chances are quite high that you may be insulin resistant. So check if you have that. There are these small little fleshy tags which sometimes develop on your skin, and most doctors just cut them off and they say, oh yeah, we just cut them off without actually thinking about where they may come from. If you've got a condition which is called acanthosis nigricans, so there are basically sort of skin discolorations which are often happening around the neck or under your armpits. It's just slightly darker sort of colored skin. So if you have got those sort of slightly darker skin patches, chances are quite high that you're insulin resistant. If you've got any erectile dysfunction, again, as I said, some experts are actually arguing that erectile dysfunction is one of the earliest signs of insulin resistance. You may be insulin resistant. If you are gaining weight or you struggle with your weight, you're overweight, chances are that you're insulin resistant. If you have or had any type of cancer, in particular prostate cancer, colon cancer, breast cancer, pancreatic cancer, or liver cancer, then chances are quite high that you may be insulin resistant, or that insulin resistance was the cause of the cancer. And I have an entire video on how to avoid getting cancer, which is a very, very important topic as well. If you have polycystic ovarian syndrome or you suffer from any infertility, you may be insulin resistant. So that's probably something worth checking out. And if you struggle with blood pressure, then of course I would check it out as well. Check if there's any insulin resistance. And again, ask your doctor if they can take insulin levels. So either your doctor is updated and not on the old paradigm anymore and understands what's happening, then they should take insulin levels on a routine base. If your doctor is still very guideline based and is not sort of quite up to date, then just ask for an insulin test. So I hope this was helpful, and I hope I could help you to understand where most of our diseases are coming from. I have small videos to most of the conditions we are facing nowadays, which are all based on insulin resistance. Again, find some videos which I have made to guide you through a low carb lifestyle and through fasting, if you want to enter that kind of journey. But yeah, they are the most powerful tools you have to reverse or significantly reduce any sort of chronic disease. And that's a low carb, high fat lifestyle and intermittent fasting. So yeah, you wonder, okay, why is this not more common knowledge, and why does it need to be sort of a special, or why do you need to be a special person to actually do this? And since I'm doing this, since I entered the whole world of the low carb sort of movement, I've realized that there is not much money in health. You make so much more money when people are staying sick. So with medications, we're not going to kill them, but we just drag them slowly and steady to their grave. That's pretty much what we're doing in conventional medicine. And the more medicine we give, the more money we make. And that is true for doctors as well as especially for the pharmaceutical industries. There is no money in health. There's only money in sickness. And that's the problem why this is, I personally believe why this is not more common practice. So if this has helped you in any way or form, please share the video. Or if you know anyone who has a chronic condition and may need some help, please share the video, because the more people I can help, the better. Okay, I hope you have a wonderful day, and